Hi guys, for those of you who don't know me, my name's Lindsay. I run the Lindsay Aesthetics clinics and I'm also co-owner of the Academy. So before we start, if you don't already, please subscribe below, follow my Instagram and my Facebook at Lindsay Aesthetics, and let's get right into it. So in this video, we're going to be talking about prescription medicine botulinum toxin, which is Botox. So we're going to be using Botox today. This is what I use in my clinic. I also stock Azalure and Botox Allergen as well for those who use it. But for the purpose of the video, I've got Botox here. So we're going to be using that. Botox is mixed up with Torbac or bacteriostatic solution or injection water. So you're going to need that also on prescription. And then the needles that you're going to need to use are a 2ml syringe like this. You're going to need an insulin needle like this. And you're also going to be using a 23 gauge drawing up needle. Just a little disclaimer for this video. This video is not for training purposes. This is purely for technique. This is for any practitioner that is already trained in botulinum toxin or anti-wrinkle treatments. This is just a guideline of what I use. So please don't use this as training. And if you haven't done this before, do not try this at home. So what I'm going to do is I'm going to get out the Botox bottle just to show you what this actually looks like. So in here, I've got a dual pack. So you've got 2 packs of 100 units. So you can buy them in 50 units. You can buy them in 100. You can buy a 200 bottle. It just depends on how much you're going to use for your client. So this is what the bottle looks like in here. Oh, dropping it. Comes with a little your little information sheet. And this is what the bottle looks like. It's got white powder in the bottom. You can see just in there. Okay. So this is what it looks like. I'm going to open the Torbac. Now you can use bacteriostatic solution. You can use water injection water. I personally like to use Torbac. It's got 0.9% sodium chloride in and 0.9% alcohol as well. So it just takes the sting out when you're injecting. If you don't have anything with alcohol in, so like the injection water, doesn't come with alcohol, so it stings more when you inject your clients. It's just not very nice. So I always use Torbac. So this is your injection water. Excuse my nails, by the way. I've just bit them all off. I'm getting them put back on Friday. So this is your injection water. Looks like this. And what you'll do for anyone who's not cracked a glass bottle before, you can see it comes with a little dot on the glass there. So what you do, you'd place your thumb on the glass where the dot is, like that, and you'd snap away. If you break it any other way, it's just going to smash. All right, so we've got your Botox, we've got your Torbac. So to mix up the solution, what you're going to need to do is get your 2ml syringe like this. You're going to open it as so. It looks like this inside. You're then going to open your 23 gauge blue needle. Open it like so. So you've got your needle and your syringe. Sometimes, depending on stock levels, you can get them together. So you can get the needle and the syringe in one. I mix up my 100 unit bottles with a 2ml solution, which is why I buy the 2ml. But you can buy these in 5ml as well. And then what you're going to do is you're going to open your insulin syringe. And this comes with the units on the side here. You can see 10 units, 20, 15, 20, 25, 30. Okay, so that's just the units that you're going to be injecting. So I'm just going to show you some rough markings of how I mark up my injection points. So when you are treating the corrugators here, what I like to do is frown like this. So you see I've got my 11s here. So where you can see my corrugators are pulling from here. So can you see that? You see my muscle stops here. Okay, so where my muscles stop, I'll mark off. Some people's corrugators are a lot shorter than others. So sometimes they have the pole here. So you'd only need to inject here. So have a look at your client, work out where you're going to go and get them to frown and find out where the pole is. Mine is quite thick. So mine starts here and ends here. So I am going to do 2 injection points on me personally. a lot of my students and a lot of my clients will never need the 2 because they've got short corrugators. I've got really long ones, so I need the 2. So for instance, if the pull was happening here, can you see my pull comes in there? If it was coming in shorter, you'd just do the 1. Does that make sense? Okay, I'm just going to wipe that off. Just for purpose of the video. So I'm going to do 2. Okay, so I'm going to go 1 in there and 1 in there, and I'm also going to go right in the middle. So this is the sort of pattern that you want, but again, don't stick to any pattern. You want to look at your client's movement, and you want to put the dots and the injection points where you can see is best on your client. Now, this is going to be really hard to do because I don't actually have any lines on my forehead. So when you raise your eyebrows, I always start from halfway up, and I sort of start just above the arch. Now, the reason I don't start any lower is because if you inject Botox any lower, you're going to have a higher percentage of a drop brow. You're going to be very, very heavy on your frontalis muscles. So you don't want to drop. So I'd always start off high. If you're injecting an elderly client, again, you want to start even higher. I possibly would start up here and I would just do 1 line. Okay, but we're going to start here, and I'm just going to come all the way across. Now you've got your no injection zone, which is here. So you wouldn't inject there because your muscles are in the sides. You wouldn't inject across this way either. These are no injection zones. So all up here, you would not inject unless you're doing an advanced technique and you want to lift a brow, things like that. So these are no-go zones. I'm just going to take them off just so you can see where my marks are. Okay, so you're going to go here, 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 and here. Now, for your crow's feet around your eyes, you're going to get your client to squint up. Now, my lines start quite high up, and to be honest, I think the lines are there because of my cheek filler. Anyway, some clients' lines start around here, some start up here. So again, you need to assess where your client's movement is. So I would say to my client, scrunch up your eyes. They would look something like this. I would then go right in the muscle there. If they was to have any more down here, I normally do a point here and a point here. But as you can see, I've got no line, so it is pointless. But this is the normal go-to of what you would do. Squint up the other side. Again, there. And normally there and there. Again, depending on movement. Now, if we're going to go into bunny lines, I would scrunch up like this. Can you see my lines there? And I would go right in here. Now here you're staying very, very, very superficial. So these are the areas that we're going to treat. If you did want to treat a brow lift, what I do is I go into the tail of the eyebrow, here and here. And then I mark up from the arch of the eyebrow into the hairline. And again, arch of the eyebrow into the hairline. And what that will do is that will lift you. Now, when you are injecting Botox or botulinum toxin, you must never, ever treat the forehead on its own without the corrugator muscles. The reason being is because if you put too much Botox in your frontalis, you're going to drop. You need to put Botox in your corrugators to be able to support and counteract these muscles from dropping. So when you're advertising for one area and people say, well, why can't I have my forehead on its own? You can just say to them, you know, you can have your eyes as one area or you can have your bunny lines as one area, but forehead and corrugators must be treated as a 2-area package together. Never treat them on their own. Okay, so now we've done our markings. I've wiped it all off because I don't want to be on camera with that. So we're just going to talk about units and what we use on each area. Now, units for men and women are completely different. For women, the frowns and the crow's feet, I will always use between 5 to 10 units per injection point. So each of these is 5 to 10 around here. Now, when you are seeing your client for the first time, I would always recommend starting with the lowest amount. That way you're safer. You know that if they come back for their 2-week top up, you can assess if they need more. And when they come back for the next session at 3 months, if they did need more at the top up, you know you can then inject them with the higher amount of 10. So always start with the lowest. Make notes on your form on what you've injected them with and the amounts and so forth. And then next time you can always add more. So I would always do 5 units in the frowns and around the eyes for women, and I would do no more than 4s in the forehead. Now, with your units, how you would mix it up would be to add 2 ml of the Torbac solution or your injection water into your Botox bottle. This powder would then turn into a liquid, so you'd mix it up. You would then count up on your client's head how many units they would need. For example, if I had 1, 2, 3 here, and I was doing 5 per point, I would do 5, 10, 15. Okay, so ignore this. So then what I would do is, once it's all mixed up in the liquid, you would then pop your insulin needle in and you would draw up 15 units on here. Okay, 15 there. And then you would inject 5 per area. Okay, now Botox takes up to 2 weeks to fully kick in. Normally you find that it takes around day 5 or 6 to start working, and then up to 2 weeks to fully kick in. This is why we do a 2-week top up or a 2-week review to check that it's fully worked. Some clients only want a subtle difference. If that's the case, they wouldn't need to come back for a 2-week top up unless they requested it. For someone who wants a frozen look, they're more than likely going to want to come back and have their 2-week review. Also, please remember that Botox is a prescription only medicine. By law, your client will need to see a prescriber before they get their treatment with you. If you are a non-medical practitioner, or if you are a non-prescribing nurse, you will need to get a prescriber to see your clients first to deem that they are suitable for the treatment. Once your products are then prescribed, I'm just going to cover the name up on here so you can't see, but all of your products will be prescribed and signed off by a pharmacy. Same as on here. I'm trying to cover this client's name up that I'm using here so you can see it's been prescribed on the day, signed off by the pharmacy here where I've ordered it from. Don't buy products from Facebook or online because you just don't know what they are, and you don't want to be injecting something in your client's head because you are then liable for it. So make sure everything is prescribed. So that's it for Botox today. Thanks for watching. Please subscribe to my channel below. Remember to follow me on Instagram and Facebook at Lindsay Owens Aesthetics, and I'll be back in a few days to talk about more products. Bye guys.